In this video, I want to compare syncope and seizures. This comparison is critical for EMT students because convulsive syncope often leads to a misdiagnosis of seizure. While they both involve a loss of consciousness, the mechanics of the events are very different. Syncope versus seizures, we're looking at differential diagnosis here. Many often see a patient twitch after fainting and immediately call it a seizure. You'll need to understand that a convulsive syncope is a physical reaction to the brain being briefly starved of oxygen. The mechanics: when the brain's blood pressure drops, suddenly the brainstem can trigger brief myoclonic jerks or twitching. The difference: in convulsive syncope, the twitch starts after the person has already gone limp and fallen. In a seizure, the stiffening and shaking usually cause the fall. The key indicator: as soon as a patient is horizontal and blood flow returns, the twitching stops and the patient is awake and alert. Think of a seizure like a power surge. The electrical system in the brain is firing wildly out of control. It's a hardware glitch that takes time to reset, which is why the patient stays confused for a long time afterward. Now think of syncope like a power outage. The hardware is fine, but the cord got unplugged for a second. As soon as you plug it back in, by getting the patient flat on their back, the system reboots almost instantly. If your patient is shaking but wakes up the moment they hit the floor and knows exactly where they are, that's not a seizure, that's a convulsive syncope. Treat the perfusion, not the shaking.